All right, good afternoon, everybody. My name is Lorena Haber. I'm the Associate Dean of Graduate Studies and Research in the Faculty of Kinesiology and Health Studies. Thank you for coming this afternoon to our last KHS research seminar for the winter term for 2023. So today I'm excited to have Dr. Elizabeth Cooper, who's going to be presenting on research as activism. Again, just as a reminder, we're going to have her present for about 40 minutes and then leave about 10 to 15 minutes for questions at the end of it. So please join me in welcoming Dr. Elizabeth Cooper for her presentation today.
Thanks so much for joining. I'm really excited to talk about this stuff. Actually, I'm really that's a lie. I'm really tired and could nap. Like, I would really like to be sleeping right now, but if I wasn't sleeping, the next best thing is being here with you. So when I was thinking about, I got asked to talk about today, I was first thinking about a study I'm involved with around COPD, and we're looking at care pathway analytics and how we understand care and how we provide care to people in Saskatchewan who have COPD and what it's like in Regina versus Saskatoon. And I wanted to talk a lot about that. I wanted to talk about the research process and some of our findings. But one of the things with research, when you're doing research with community organizations, is their time is your time. Your time is not their time, right? So the timelines. So not time as in like minutes of the day, but their timelines. So this project was supposed to be wrapped up. Oh, well, it was supposed to be wrapped up 2 years ago. But then it was going to be wrapped up 6 months ago. And then it was going to be wrapped up 3 months ago. And then it was going to be wrapped up. And then it wrapped up 2 weeks ago. So I'm super excited it's wrapped up. We ended up talking to 25 people who live with COPD. We talked to 24 family members who have loved ones who live with COPD. We talked to 14 healthcare providers, and we looked at patient records for hospital admissions and pharmaceutical use and so on and so forth to see what's happening as the healthcare system merged together, as the different areas merged into one. They're finding that what's happening in one area is not always the same as what's happening in another, and they want to have what's the best approach. And they want to use research as a way to advocate for that change. Research is a way to advocate beyond this. Research is a way to move beyond just an evaluation. So beyond just does this work or does this not work, to have some background and backing so other people can take this and say this works and this works really well. We found that maybe it doesn't work quite as well as we'd like it to, but that'll be a whole discussion for maybe next year. So as I was thinking about that, I was thinking, oh shit, we don't have the results yet. We don't have everything. I don't have it all organized. I can't share all this crazy, amazing, wonderful stuff. One of the last things that happened is one of the participants said to me, he's like, I feel like I was finally heard. And he started crying, and he said, I've lived with my wife who has COPD for a year. COPD is chronic, and it's terminal. People do die. Usually it's a very long time. And we have 65,000 people in our province who live with COPD. So there's a lot of people who live with this chronic lung condition. And he said, I wake up every night thinking my wife's going to die. And he says, and now I know she's not going to just die overnight. And I didn't know that. People didn't tell me before I heard from the other people in the focus group. And he said, I am so glad there are people doing research. And I thought about this, and I thought about some of the other people I work with, other research projects I work with, and we just got some funding to do this. Really, I think it's really cool, but you should always think your research is really cool, right? This funding to do a 1-week youth camp with kids, teenagers, who identify as part of the 2S LGBTQ IAP+ community and are Indigenous in Northern Saskatchewan, to see what are their mental health needs, what are their service needs, what addiction supports do they need, what does their community need, and really listen to them. And we've got people from the Health Authority and people from across Canada who are willing to sit down after with these youth and say, what do you need us to do? We're listening. And we will help act and advocate on your behalf. And I thought, how? And then that's going to get put into a special conference working group to change standards of care for the country for mental health supports. So it's one of just many, 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 many studies, right? It's just a teeny tiny drop in the barrel, but it's a teeny tiny drop in the barrel. And one of the feedback I got from reviewers was, why should we care what's happening in Saskatchewan? And I thought, well, because we need to advocate more. If people are asking this, we need to really get our voice out there, that there's advocacy happening. And so I was thinking about all of these things and thinking about all these pieces and about how we're in a really unique place in the university, right? We're in a really unique place where we can have some of these voices. We can talk at different levels. We can work with students. We can work with the healthcare systems. We can work with patients. We can work with really crazy, cool, amazing, wonderful human beings, right? To make change and to build these spaces. But what do those spaces look like? And this is something I've been struggling with for a long time. Like, what do those spaces look like? What does it look like to be in a research space, this community research space? Is it doing murals on a wall and talking about it? Is it doing focus groups? Is it doing interviews? Is it looking at your big administrative data sets? Is it piecing it and parsing it all together? Like this really cool new recipe? And it's not easy work, right? As soon as you try and like make a new recipe, it's got all these different flavor combinations and profiles, and sometimes it works really well and sometimes it does not work as well. And there's always challenges. And some of these challenges in some of the places I work a lot with mental health. So some of the challenges are very, very real and very, very sad. And at the beginning of the pandemic, I was still thinking about these things, right? I was still contemplating, like, where are we at with this? And thinking about, who are we responsible to? Are we responsible to the funding agencies? Are we responsible to discovering something new? A lot of the time when we're writing our grants and stuff, we're like, we're going to discover this, or we're going to test this, or we're going to do these things. When we're working with communities, we talk about OCAP. O, it means ownership. So who owns the data? Who can use the data? Who can decide what to do? I've been having some conversations the last couple of days about grant funding and saying, like, okay, so if it's community-based research and community partnership research, who decides how that community partnership research is spent? And just when you think it's done collaboratively, sometimes there's still this idea of power differentials because we're coming from an institution that's holding the money. So who owns the data? Who owns the program? Who owns this? Like, what does it mean to even own something? And that's like, I think that's a question I grapple with a lot, is like, what does it mean to own something? I own my dog, but I don't think he maybe owns me, right? Like, you'd have to meet my German Shepherd to understand this. And apparently I'm automatically advancing here. Sorry about that. So then I'm thinking about, like, who are we responsible to? And who is, sometimes it's topic dependent and sometimes it's project dependent. Sometimes looking into issues like mental health. Sometimes it might be more broad, sometimes it might be more specific. It's like the students in your classes and you're working, you're like, okay, your thesis statement is one line, it is not 10 pages, right? So what is our one line that we're doing? And is that going to be looking at changing trends? Is it fluid? And always remember, we can't promise everything. We want to change. Like, I would love to say, again, this mental health project, that kids who identify as Two-Spirit or as part of the queer community are going to have so much better mental health. And there's almost a belief by sometimes when you're talking to people that will happen. And then we have things like Out Saskatoon cuts all its funding. And the community partner came to me on Thursday and said, and some of the community members who were on this grant said, do you think this research study can take over what Out Saskatoon was doing? And it says, we don't have the funding, we don't have the capacity, but we can do a little bit. So we need to watch for changing trends. And we need to unlearn acts of decolonization. So it's looking at, how do paradigm shifts happen? How do we rethink gender? How do we rethink culture? How do we rethink our role? How do we rethink community? And how do we rethink our position of power and of having and holding space for other people to do what they need to do? We need to make sure that we're always looking at prior knowledge and we're always learning from one another. We need to use memory and memory work. We can't just say that, oh, well, there's recall bias. Sure, there's recall bias, but what does that mean? Where do those memories and where does that hold these grains of truth that we need to learn from and move from? Healing involves memory work. Research, especially qualitative research, involves memory work. And when we reframe our narratives, and we reframe it to think about unlearning and to think about advocacy and to think about how we can shift through trauma, we can maybe think of hope for the future. We can think of a way through. And we can think of ways to help improve the healthcare system, to improve care for people with COPD, with lung health issues, with experiences of COVID-19, experiences of dementia, all these different things. And one of the things I did when I was grappling with all these different concepts is I reached out to a couple friends and I said, like, how do you do with this? What are you doing? So Crystal Watson is still a PhD candidate. She's doing amazing work in Nova Scotia. Arazo Blachette is a assistant professor at the Université de Montréal. She's not at Calgary. I'm just changing this. I apologize. So she's at Université de Montréal. And I said to both of them, I'm like, what do you do to deal with these topics? How do you do this? Especially when there are suicides. So a lot of the time when I'm doing the work I work with, there are suicides that happen, and suicides, mental health crises, and people who were working for you who suddenly are homeless, or people who are working with you or you've worked with or you've built relationships with where suddenly someone's in jail or suddenly something else happens. How do you deal with this? How do you keep going? How do you keep doing this work when there's so much pushback, when dismantling the ivory tower is not a one-person job, right? So where do we come from? And so we decided to do a little study to try and explore some of these issues that I've talked about. And so we got ethics approval, and we did targeted recruitment for people who work and have experiences in community-driven research and strengths-based research. We asked for people who worked in academia and who either trained people, were a trainee, a faculty member, and we looked at Commonwealth countries. So we looked at Canada, Australia, New Zealand, and a couple countries through Africa. We did 16 interviews. Half of the people identified as members of the BIPOC community. We also had a number of researchers identify as part of the queer community. And most of the people were Canadian. And we talked about these different concepts. We talked about these different ideas. We talked about what does this mean? What does it mean to do strength-based research? A lot of strength-based research is advocacy research. So these are some quotes I really like that we pulled from these interviews with other people grappling with this idea of relationships and advocacy and working in sensitive topics, the sensitive topics being things that can kind of be hard to talk about, things that might be triggering or traumatizing, things where we have like that big asterisk for your ethics application to that. What are we talking about here? And we talk about doing strength-based research a lot. This is a buzzword we're using, but what does this buzzword mean? So one of the researchers said, you asked me about strength-based research, and I'm like, I don't even know what you mean by that. And we heard that a lot, like, I don't even know what you mean. And some people were saying, well, it's just not deficit-based, like you're looking for the good, not the bad. But what really seemed to come out was the idea that it's looking for solutions. It's taking the point where you're at and looking for ways that change can happen. It's creating space from which other people can lead. And I really like that idea of strength-based research. But I also love this definition from an academic. I think it's coming with curiosity. I think of it as joining with people. It's an orientation to me. I suppose it's a method, but it's first an orientation. I have something to learn here. I respect you. I'm interested. I'm curious. I'm patient, and I'm ready to learn. And then from there, you sort of tell me how life works for you, as opposed to telling me how you're troubled or telling me how you're problematic. And I think if we start thinking of strength-based research and community research and advocacy research and health research from this point of, tell me what life's like for you. Tell me what lessons you would like me to learn. Tell me what lessons you would like me to share. We get these grains of how we can improve health and how we can improve healthcare systems and how we can improve institutions. Sometimes it's hard to hear the hard stories. Sometimes when we talk about strength-based research, there are some people, even my interview participants, who said, oh, well, this way we can just focus on the good. I'm just going to focus on what's working, what's happy, what makes people happy. I'm going to focus on the good. But one of the things that we were told is that hard stories are actually a gift. Seeing these things, having people be vulnerable. I was doing some work in the community this last week, and there are a lot of people who cried. They were talking about really hard things. And it's a gift for people to cry in front of you, and it's a gift for them to share the hard things with you. It's teaching you, and when you hear these things, it transforms you. You can't leave because you've been affected by these gifts of these stories. There's we need to remember why some of this stuff works and why it's important. One of the participants said, there's nothing interesting about researching the pain of others. And I think that's really true. People ask, well, what are you interested in? Why are you interested in this? What's your research interest? And what this person said is it's really about being able to retell stories that people want you to retell. And they've given you this gift of the story. They've given you this gift of experience. They've given you this gift of their knowledge and their pain, and they've let you hold that pain with them. And so when you share it, you can, using a trauma-informed approach, really, what you're doing is you're sharing things that can make a difference. And that's the point where advocacy starts and activism starts and relationships start, that gift. But it can't just be one-sided. We have to give gifts back. You have to share too, right? It's not just listening, but it's that when somebody shares something really vulnerable in a research context, I mean, you don't want to give all of the details of your life. You don't have time to give all the details of your life. But you want to share back too. You don't want to just be like, oh, okay, that was interesting, because that helps leave people vulnerable. And you want to kind of close the circle to a bit, right? So, and you need to remember that what they're saying is transformative for them, like the person I was telling you about who said, I now know I can sleep. I said, I'm still going to worry, but I know my wife isn't going to just die in the middle of the night because she's at early stages of COPD, and there'll be people there who can help her and help me when she gets to that point where we need to worry about it. And it also is a place where we can have kids say at the end of being part of a program and activities and research that I can go to university too, and I can do all these cool things too. And see that glimmer of hope, because it does teach us and it transforms us, all of us, them just as much as us. Even telling your own story. When you tell your own story, you learn something more every time you tell it, in a different way as long as you're present. So relational research is about negotiations and consensus. So I know my slides are a little text heavy, but I just couldn't pick what the best parts were of these. So it takes a lot of time and there's a lot of patience, but also it's about treating people with respect. It's meeting them where they're at and it's following at a pace they're willing to go. Not everybody's going to jump in and tell you all the details of their life. So sometimes it's about that pace. It's about being patient. And it's about making sure people know you've got the time to meet them where they're at. It means you have to park your agenda at the door, so you might finally get a meeting with people within the community, and you might have all these ideas of things that are going to happen during that meeting, and it doesn't. And it could be that people don't show up. It could be that people talk about other things. It could be there's a whole different agenda. It could be you sit down and they're like, okay, we're talking about this now. You just have to kind of go with it because you're building that relationship. You have to be willing to go slow, because if you keep pushing against your own time pressures, your own sense of what you think is an appropriate pace for progress, you're not going to be able to be successful or advance anything. So you have to meet people, you have to follow what other people's timelines are, like the health authority with our recruitment, right? And often it's taking time and drinking tea and having a meal and talking about all kinds of things. It doesn't have to necessarily be the research project itself, because you're meeting people and you're developing a sense of who everyone is, and they're developing a sense of who you are as a researcher. And they're making decisions if you're a good person or not. Should they trust you with their stories? Should they trust you with their experiences? And it's a time when you're actually thinking about how are you going to proceed. And I think sometimes we don't think about that when we're designing our research studies, or when we're talking about this is planning in that time, that consistent time for a team, right? Sometimes we have it in the middle, or the beginning, but we don't have to have it in the middle. We don't plan those times in the middle to keep building those relationships and just spending time with people, visiting and being there, listening about whatever's going on in their work life or their personal life, or talking about U.S. politics, whatever it might happen to be. So you just have to kind of have a level of trust that's beyond any imagination. So you really just have to, ultimately with every core of your being, and this is really hard for me to do sometimes. I'm definitely type A personality. It's definitely hard for me to be like, it will work out. Maybe it didn't work out this weekend, but it will work out. It will make sense eventually. When we look back, it makes sense, and I can put these pieces together. And maybe I didn't learn what I thought I was going in to learn, but we've got something. It's a two-way process. And if everything that's a two-way process requires time, because you're working with two people, or two communities, or two institutions. And by doing this, we need to recognize that sometimes research ends. And sometimes relationships end, and that's okay. It moves beyond, sometimes it moves beyond a focus scope too, to something broader. And I think this is a really good lesson that a lot of the academics who'd been more senior, who'd been working in community-based research on sensitive topics for 20, 30 years had to say, is that sometimes your relationship with people ends. Sometimes it's okay to say, you know what, we came into each other's lives for a reason at that particular point in time, and I wish you all the best. Sometimes it's okay to say, I'm going to say a prayer for that person, or I'm going to think good thoughts about that person, and maybe I'll send them a Christmas card, and that's all the relationship it needs to be. And I think that's really important to think about. It's helped me, because it's hard when you move around a lot, and COVID was really hard because I had people I wanted to see and talk to, and I couldn't see them. And there are a lot of people who passed away, and a lot of communities who people stopped working. They're like, I am not working in this field anymore, and they're just gone. So then you're like, but I had that relationship and I have this responsibility to them. But it's okay to be like, you know what, my responsibility was in that moment, and they're allowed to move on with their lives and do other wonderful, amazing things. They don't need to tell me what they're doing. And somebody will show up later. I'll send you a Christmas card. Somebody sent me a picture of their baby that they just had. I was like, haven't heard from them for 3 years. Adorable baby. Right? So you never know. But if you can just sit back like this lesson this elder gave one of the participants and said, just sometimes that relationship is that thinking of the other person piece. It makes me feel better. So it's important to be clear about your values and the values of your community partner. If your values are not aligned, it's not going to work well. So you need to make sure that you're on the same page. You need to make sure that you understand what the other person's going for and what's driving them and what the purpose is, and make sure the purpose is clear. You have to be able with the attitude when you're doing relational research. You need to go in and think, I'm in this to learn, I'm not the expert. Otherwise, we wouldn't need to advocate for a different change. If everything was already perfect, we wouldn't need to have this. There would be no gray zones, there would be no wicked problems. Oh, and the research is complete, those relationships extend. What we talked about sometimes goes on for generations into the future. I've been in communities where they've talked about stuff their grandparents did or their great-grandparents did as part of research studies. I know with my own family, they would talk about different times people were involved in research or what happened with my grandparents or my great-grandparents. My great-aunt was a nurse. She worked for the WHO, and she worked in Egypt in the 1950s, and I still hear stories about what was happening in some of the research she did as a midwife. These things last. It's beyond just that little period of time. Somebody said to me the other day, they're like, just think 5 years from now and nothing will matter. But I think it's actually 5 years from now, so much will matter. Part of what matters is how we do data collection and how we build those relationships and what we do. So some of the things that I do are things like designing board games and cultural programming and youth camps and art projects and going to protests. And if somebody says, can you be here, I'm there. If somebody wants to make a video, we talk about okay, how can we make that video? How can we embrace things that are creative? It was interesting yesterday after my 200 level class, I had a student come to me and said, I know you said you have to be creative. I'm not that creative. I don't know how to do this. I can't be creative. I said, be creative like a scientist. Scientists are really actually very creative. But I said, you don't have to pretend you're creative like somebody in theater. Be creative like you are. Just see the patterns and put it all together in a way that's unique and interesting. And so when I say embrace creativity, although some of the stuff I do is like this board game I developed with community members, or we hired an artist to do, and it was based on data collected. But it's not always like that. Sometimes it's just creative problem solving to get to that answer you need to get to. Another thing we talked about a lot with these academics was the idea of ownership and idea of ownership over information when it's published. So all the time in community-based research, we talk about how participants should be involved and community agencies should be involved as authors. They should be co-authors. But then you have to do this checklist being like, did the person contribute enough? Did they do this? Or you get asked, did they read through this? And if you're working with people, like some of the people that my participants in this study, the academics worked with, who have very, very low literacy skills or very transient, having time to sit and read an academic paper when you might not even have finished grade one because you lived in a refugee camp, it's not going to really happen. But where we have the idea of ownership and authorship and this collaborative knowledge, and sometimes comes to the author stage, sometimes it's at the acknowledgement stage. Those are kind of our typical areas. But what came out a couple times, especially with Indigenous scholars from other countries, was the idea about putting this knowledge into the background in the discussion, listing those people as your theorists, listing that informal discussions, and making that my theory is the theory based on this elder. My theory is the theory based on this child. I was at a talk last night and they were talking about university relationships, and I said after to somebody, like, the biggest lesson I learned from my PhD that I keep telling people is this one little girl, she was 10, and she said, research is really easy when you're working with communities. Just say hi and don't be a jerk. And I thought, maybe that's like the key to it, but I keep coming back to this. So that's something I would be, if I'm writing a paper and I'm talking about how to build relationships, I would put that in my background and methods, because that's what's informing. What's informing how you see the world? What's informing? It's not just your methods. It's not just like, I had this consultation and I did this and I signed this paperwork and we have an MOU and whatever else. But it's that theory piece. It's that, like, who you are and how you built that relationship and how you learned. And I really like that. And then you're doing more than just giving somebody, like, for us as academics, of course, like having lines that you can put on your resume being like, oh, I published another paper. I did this, I did that. That means something. It doesn't necessarily mean the same thing to some of your community members that you're working with who might be partners and advisors. But saying and putting it in there and saying to them, like, look, I put in here that you and your thoughts and your thinking and the lessons you taught me and the lessons you learned from your grandparents, your great-grandparents, or your auntie or whatever, that's what helped me understand the way and see the data the way I saw it, to see the world the way I see it now. That gift you gave me, that's more than just an acknowledgement. So putting it right in the body, I really love that idea. And we had a couple people say that. So I think that's a really nice way to move when we're thinking about relational research. And we always have the question of, can I leave it at the door? Your workday's done, go home. You're finished. It's 4:00. But when you're doing this work on sensitive topics, when somebody has just told you a story that's really hard to hear, and they've asked you for help, it's really hard to be like, oh, it's 4:00 now, especially because a lot of the time, most of us aren't necessarily trained as counselors and therapists, but even those people still take it home with them. So what people said was, I'm an artist, I'm a peace builder, but I'm also a researcher. I bring my intersection between arts and peace building and my lived experience. And another said, I don't do a good job at that. And said, I try to put things aside because I need to look after myself, but that's my relationships, it's my community, it's what I have to do. And this person said, I'm grateful that the work I'm involved in is with me, and realistically, I can't cut it off. And they said that they don't really think about work-life balance because it's really lucky to be doing this kind of work. And it's a sad, how can you possibly say, oh, it's a Saturday afternoon, I'm not going to think this afternoon. Just that this person said, I can't do that. And then later on, they said, I don't want to do that. That's not the kind of person I want to be. I think there's still something to be said for self-care, though. So self-care, even if you're not leaving at the door, self-care can be unpacking it with somebody else. So this is one of my very good friends. Her name's Rosa, and she is a economicist, professor. She's from Columbia. And we do a lot of unpacking the hard issues, not the confidential stuff, but the hard issues together. And we before the pandemic, every year we'd go on a girls' trip together, and we'd just go shopping, and we'd go to restaurants, and we'd unpack things. Sometimes it can be hard because you can think, I'm so privileged. How can I be privileged enough to go to Hawaii with my friends and this family I'm working with can't even feed themselves? And the only difference is where we were born. Someone else said, I know that happens, but I have to build better habits. I have to recognize the value of things around me and be mindful of it. I need to do little things, like realize that going on that walk along the beach, spending time with my dog, these things matter, and give yourself permission that it's okay to be happy. It's okay to take time. It's okay to not work all the time. It's okay to just enjoy the little things in life. And then someone said, and then my supervisor told me when I came home that just sort of went up in January and came home in July or late July, said, yeah, I don't want to see you for a month. Go somewhere, go do something, go camping, go canoeing. But just be out there, take that time. I had a meeting last week with some staff that I have, and I told them, take an hour every day for self-care. You're doing hard work, take that time beyond your lunch. Just take that time, do that reflexivity, do that piece, so you can take care of yourself, because if you can't take care of yourself, you're not going to be able to take care of other people, and hearing those stories is helping to take care of them. This person said, I don't know if I love the phrase self-care, because to me it's individualizing. I want those structures and system pressures. I seek to not have it all land on me alone, because then I run the risk of failing and not doing good self-care. Or like it's just so individual focused. So ways I find to sort of broaden it out to think of self-care as the idea behind it. And it's really about how can you have longevity in the field? How can you keep doing this and do what you need to do it for a long time? And then one person, I really like this for academic, right? I try and put things creatively on my CV, and that's kind of self-care. So I have not embraced that yet, but we all have things to aspire to. The question is it time for a paradigm shift? Is it time to be thinking about how we do research differently, how we build relationships? And so one of the people said it becomes challenging as a researcher because people said yesterday, someone said, well, you've just got to play the game. And she's like, I'm 50, I'm tired of playing games. And I think that's fair, right? Tired of playing games. We need to do something differently. We need to argue and know that our research is robust and valid. And because we're in relationships, we also have to think about subjectivity and objectivity. We need to rethink the idea of strength-based research. We need to rethink what that means. It's not just the good things, it's the hard things, and it's the looking for solutions. We need to think of this as a form of service. It's not just research. And we need to remember that a lot of projects start on the heels of other projects. And say, okay, so now what do we do? Okay, we should learn from some action from that. What action should we be doing? What should we be doing next? What's guiding what we should be doing? And really always having that they're not interested. People are allowed to move on, allowed to do different things in life. You're allowed to have new interests. You don't have to always be interested in the same thing. But sometimes there's some really neat stuff that comes. For example, my PhD work was working with Indigenous women and girls, and I ran workshops, and we thought about trauma-informed care and best practice. And then my postdoc research built on that. And I worked in BC with people doing the same thing. And then I got a grant called Nurturing Warriors, and we were working with Indigenous men to understand relationship building and understand risk behavior and think about some discussions there. Be able to have some of our Two-Spirit youth come into these spaces, but it's not always safe for them. Can we have our own spaces for Two-Spirit youth? So we put in this grant, this money. It's really exciting to build that. It's really exciting to say that you really love what you're doing. And it might not be that you set out the way you meant to set out. It might not be that you came to what you thought you were going to come to. But everything fits together. It takes years. It's not just a moment in time, it's years. And I like this end here. It says, because when people go through the process, the research process and the experiences, they get, as builders and creators, new knowledge. It helps them view their community better. By working together, it does that piece. I'm going to share with you my favorite quote from this project. So, we talked to academics, like these were like intense long transcripts, right? But I love this one. We talk about how can research change the world, and we're like, oh, it can't do anything, and what are we doing here? And we tend to spin. We're really good at spinning in academia. Not like spinning as in this idea, I'm going to get this funding for this, but spinning on our wheels. Or the chicken and the egg conversation. If it's this, and then we're back to where we started. We're back to where we started. And we had this conversation 6 years ago, and we're back to where we started. And especially when we're working on really hard topics, a lot of the time feels like you're back to where you started. Especially when you have yet another suicide, or yet another case of abuse that you see, or yet another financial crisis. And so we said, does this work? How does you see this? What's your role? How do you see this happening? And I'm going to leave you with this last thought here. I don't think anyone's ever changed the world. I mean, the world just kind of changes itself. And maybe some people are capable of nudging it in one direction or another. And so I hope that all of you who are listening and all the people you know and love are capable of nudging the world in just a little way to make it a little bit better. So thank you very much.
Thank you, Elizabeth. So we do have time for questions if people who are here have questions for Elizabeth. I have a question, Elizabeth. So one of the things that you talked about, there's a lot of things that are, I think, really important to understand about how this type of research is different, and we have to have different skills and different practices. But that might be a challenge sometimes for students. So one of the things you talked about was time and thinking about time differently. So for graduate students or undergraduate students, honor students, what advice would you give to them about how do they have to approach time, also knowing that they have limited time to do what they need to do?
So a lot of the time I'll ask people to think about where their background and their experiences are. Can they fit into something that they've already known? Can this play on other experiences? Or maybe taking that extra time. Do you have time to take an extra? If you want to go and travel somewhere else, I was very fortunate in my PhD. I got to go and work in India and work in New Zealand and do this, but it took time. It extended my PhD by a year. So do you have time to do that? For me, it was a value. So I did that. I also encourage people to not necessarily make it less people you talk to, right? I don't think it's about, all my research is case study research. It's all case study. All along I've been trained in case study research. And sometimes that case study might be a couple people you're doing living narratives with, but sometimes it might be a specific moment in time, or it might be a really focused concept, and then to pick the right method. So what method are you going to do? Are you going to do photo voice? You can build relationships fairly quickly. Are you going to be doing something where you want people to be telling about some really sensitive topics? Probably not going to necessarily get there. If you have lived experience, though, so when I started doing some of the work I did, and I do, my best friend when I grew up with, her brother died by suicide when he was 19, and she died by drug overdose last year. And so when I go into communities and they're talking about sensitive topics, I get to the heart of stuff, people trusting me and talking about this really fast because we have a shared language and we have a shared experience. If you don't have some of those things, you can't expect to get into it right away. So really just making sure you pick something you're passionate about and really be targeted and really think through the method. And if you've thought through all those pieces, there's always a PhD or there's always postdoc or there's always more things or evaluation work. You're putting a little drop in the bucket. And I think that's a really nice way to think about it. But also to be aware that if you really want to get through in that short period of time, you've got that, you're going to have a baby. I said that to somebody the other day. I'm like, if you're pregnant and you're going to have a baby and you want this done before you have the baby and you're thinking you want to do qualitative work, maybe you want to do a survey. Maybe you want to do something else. Maybe you want to build on somebody else's research project and go in because you might not have the time.
Thanks. That's an excellent response to that. Other questions for Elizabeth? Sure. I'm going to come up with the mic for you. Just so the people other people can hear.
I just wanted to ask if you were aware or knew of databases for research outside the universities, because just as a consumer, the only times that I came across is through advertisements in the newspaper or now social media. And when I say database, I mean databases in regards to topic areas, researchers, even participants at the international, national, or provincial levels.
So you're thinking about research that they already have that you can see what they've done? Or are you thinking about participating
potential
research?
Yeah,
or
upcoming
potential?
research, databases or because I know research that's done, you go to your PubMed, your Google Scholar and all that.
So when you're publishing?
Yeah, so if you're wanting to start a research project or you're looking for participants, are there other well-known databases where citizens could, look into? Or
Not easily. So there's some surveys, there's a project I was involved with where we were looking at has Ghana been meeting their UN development goals in terms of nutrition. And they have a national survey that's been done, and the information is all public. You can get access to it online. So for some of those things, there are databases. Same thing with using some statistics, even Statistic Canada data. Some of it's available, others isn't. You need to be in a place that's been granted permission to look at it because some of it's considered confidential. So the best advice that I usually say to people is, in communities when they ask questions like this, is to sometimes you can get membership in different organizations and societies where you can get access. Sometimes you can also match with and pair with a student or a researcher who has access to some of this. Some community organizations have their own databases. So research that I do with the Indigenous communities, that at the end of it, it goes to them. They use it, they create their own database. My master's thesis work, which was way many years ago, it's in the archives in the Northwest, in the Yukon, and it's also in the community archives. They kept everything so they can use it later. And they have a website where if people are interested in being part of research or wanting to know what information's there, they can access it. The Gabriel Dumont Institute also has a list of what resources they have and what different things they have in stories. You can put in a request and access it, like archive stuff. So there's lots of different ways. I've been trying to find information out about long COVID because I have a personal interest in that. And it's really hard to figure it out. And like, where is it? You try different groups. And it's like, oh, and then it's almost like you try, and then you hit like this one like magic thing. It's like this whole like world opens up. And you're like, oh, where have you been all my life? Facebook group, right? Or whatever it is. And sometimes it's just that digging. So that doesn't quite answer your question, but hopefully it gives you like a bit of a starting spot. Figure out what you're interested in, and then find people who are also interested in that, and then they might know where different resources and supports are. And sometimes what I've found, I work a lot with people with self-injurious behavior and severe autism and fetal alcohol spectrum disorder. And what they found is there just isn't the work. It's just not there. So people would like to see it. There's huge wait lists. They want to see this evidence that can push for better care and diagnosis and supports. And it's just not there.
Thank you. We've got time for one or two other questions if anybody else has one. I have a practical one, Elizabeth. So you talked a bit about this project and how the transcripts were quite long. So just out of curiosity, because some of the students in Kin 220 will be listening to this as well too, how long were the transcripts?
Oh, well, Lauren helped me with some of the analysis, so she might have a better memory than me.
Like, how many pages long? Do you remember?
40, 50, 60.
40 or 50 pages
for
long?
an hour interview. And
That's
a lot
long.
of it was
That's
really
long.
dense. Right? Does that sound right, Lauren? Yeah. Most of it, I think the shortest one was about 42 pages. And it really was dense like this. It was not Sometimes you'll get like a focus group or other stuff where it's really short, it's short sentences. Yeah. This wasn't. This was like deep, in-depth paragraphs.
Mm-hmm. Okay. It's just interesting sometimes from the practical side, just to get a sense of like how rich that is, how long that is, how much data that is.
Well, it was interesting. I'm going to tell on my couple graduate students here. They're working on a project with the SHA to try and figure out so Saskatchewan in Regina doesn't actually have a list of what GPs are taking new patients in the city or what GPs are in the city. So the SHA asked if we could look into this. And so it's a bit of relationship building. Remember I talked about that like giving, that give take. And sometimes you do stuff that's not necessarily going to benefit you because it's part of having a relationship. So one of the things is that they asked us to look into this. So they're looking into it. I said, document how long it takes you to make these calls. How many calls you make when you get a hold of people and you're asking them, like, is it fee for service? Is it contract based? How many doctors do you have? Are you taking new patients? Do they have any specializations? Really document how long that is so people can see, because they might think it's really short. Right. I think when they asked us to do this, they're like, oh, I think there's like call 30 or 40 clinics. They probably thought that was going to be like an hour or two. And as these wonderful humans were telling me earlier, it is not an hour or two. And I think having that, just even listing it and documenting it so people know is good. And we have this, like, even though we went to school, I mean, maybe not we, maybe just me. This might be a me thing. But I block some of this stuff out. I'm like, that didn't take me that long to read. It didn't take me that long to do. I'm sure I did that lit search faster. And I was like, oh no, No, I did not. So documenting some of these things, you can almost have a timeline of how long it should take. I think is also really good practice. It's good part of we do a research audit. So when you do a research audit, did this and this. This took this long, this took this long. It's good to include these things in it.
Any further questions? Yep, Polly.
For the transcription, did you do it yourself? And have you always done it yourself, or do you hire students, or do you hire a professional transcriptionist?
Okay, so I don't do it myself because I have a wrist injury and I can't type that much. I used to. I'm trained as a musician, so I've got a really good ear. I can type pretty fast, but then I could not use my hands after. So I use a transcription company. It's good for students to learn, but we just need some of this stuff done pretty fast. We actually, the company we used for this stuff was it was like a company, but it was a PhD of Dalhousie that worked with my colleague. I've used other transcription companies too. I think it's really great for students to learn. I did my transcriptions for my master's and my PhD myself. I think it's great to do this. But there's also something to be said for doing the analysis piece and to be doing the writing of papers pieces rather than just like the typing up 60 pages of text. So I would rather pay somebody. But now I'm using a software program. I'm using an AI program, and I love it. I'm like the biggest geek about this AI program. Everybody has to listen to me talk about this AI program where you upload stuff, and in 20 minutes you see what the transcript is. It'll see when it goes with the color. You can make the changes. You can download it. You can delete it off their server. It's gone right away. You've got the whole thing done in an hour, and it's $10 an hour to transcribe instead of if you're paying a human being, usually you're at hundreds of dollars an hour. So it's just so much better, and then you can get onto the fun stuff.
Any further questions? All right. Thank you very much, Dr. Cooper, for your presentation today.
Thank you very much for coming and for watching online. Hopefully you all stayed awake. Thanks, Elizabeth.